In August, I got my hand caught in a brake press at work, and I lifted it up off my own hand, and we went to the nurse and then to emergency room where I met Brian, and he came in and we discussed on whether or not to just take the fingers off. After the first surgery, I had to wait 7 days, and then I came in and we had the reveal of what I ended up with at that point. When I came in to have my hand revealed by Dr. Tallow, he was very concerned on how I felt and whether or not we were gonna continue keeping on with the middle finger. When we decided, it was a mutual decision on every process on whether we were gonna keep the fingers, any of them, in the second surgery. And when the final decision was made, it was between the both of us, and I made the final decision.
My name is Amy Maloli. I'm one of the hand therapists here at Muskegon Surgical Associates. I'm a certified hand therapist and have been working with hand therapy for over 13 years now. I had the pleasure of meeting Kerry back in September after her initial set of surgeries. We started off by working on wound care and helping to heal up her initial injuries, her skin grafts. As Kerry's healing process progressed, we realized we needed to start looking at some prosthetic options. Through this search, we discovered Hanger Prosthetics. I contacted their organization and they came to MSA. I invited Kerry and we sat down with their team. We learned what they did, what services they offered, and how they could be of assistance to us. She will eventually have 3 prosthetics. One is the Quantum Hand, which has the eye digits, which are electronically controlled by her muscle contractions. She has point digits, which is more of a ratcheting set of prosthetics, which she wears for work. These prosthetic fingers can handle more resistance and more weight, and she can also get them wet, so she can wear these when she's out kayaking. And her last prosthetic that she hasn't received yet is a passive prosthetic. This is a prosthetic that she'll be able to wear for formal pictures. It is painted to match her skin tone exactly. She's been through multiple settings with this to make sure they get the coloring just right. There is an awful lot of options out there for individuals who have lost their digits, whether it's one finger or all their fingers or even up to their elbow. The world of prosthetics is advancing very rapidly, and I've been honored to have the privilege of working with Kerry and the entire prosthetic team to help her learn how to use this.
One of the things that's quite unique about the MSA Hand Center is that it allows us to collaborate with our hand therapists and our schedulers. There are a lot of patients that come in to schedule for hand therapy, and I get to see them during my routine clinic schedule. And so typically after we operate on somebody here at the Hand Center, they get hand therapy. They get back to see the surgeons, and if there's any questions, the hand therapist or myself can just walk over right next door and see the patients. So I think it gives us the ability to collaborate and bounce ideas off of each other. The hand therapists collaborate with the prosthetists if we need them. And in Kerry's case, that was quite beneficial for her. That we got to see her often and see her progress through her different surgeries and fitting of her prosthetics. And that helps me learn and take better care of the patients as they come through.
Over my experiences with the therapists and my prosthetists and the doctors, everybody works together to try to make sure that I have what I need so that I can get on and do the things that I want to do with my life and not have the struggles that I would with missing the 4 fingers.